Caprini arthritis encephalitis, commonly referred to as CAE, is a viral disease found in goats and sheep. There is two ways CAE presents. Adult goats develop chronic arthritis, young goats develop a neurological syndrome, with signs of paralysis. Less commonly, mastitis or pneumonia may occur. Infection is lifelong, and it may be years before signs of the disease occur. This is why it's important to have all your goats tested at 6 months of age. Goats are frequently sold before 6 months of age, and if the parents are not from a clean tested herd, this can have a detrimental effect on herd health. CAE is manageable through biosecurity protocols and responsible breeding practices. The disease is spread to goat kids when they drink milk from infected goats. Separating goat kids and feeding the kids with goat milk replacer will help prevent infection. The disease can also be spread from goat to goat via contact with body fluids, such as saliva and blood. There is no known cure for CAE. To prevent spread of the disease, infected animals are separated or culled from the herd. While that may seem harsh, this disease can quickly affect a lot of livestock. At least they should be removed from breeding programs and placed in pet homes. If you decide to keep goats that are CAE positive, the most important thing to do is support their joint health. It is best to work with a veterinarian if your goat is experiencing pain or neurological symptoms. They may need to be on pain medication. There is also a wide variety of joint supplements, but remember to always consult a vet. Another thing you can do to support joint health is frequent hoof trims. Any overgrowth in their hooves can lead to severe pain. CAE-positive goats are more likely to suffer pain from the virus if their hooves are not well trimmed and cleaned regularly. They always need access to deep, dry bedding so they can rest with less pressure on their joints. CAE can also affect skin and coat health, so it's important bedding is not wet or dirty. You will need to learn about biosecurity and come up with the best plan for you. There is a lot of ways to structure your biosecurity protocols. But here's the basics for CAE-positive herd. Always separate kids from does to prevent nursing on infected milk. Regularly have your goats' blood tested by a vet. Avoid housing and feeding infected and non-infected goats together. Regularly clean using a strong disinfectant. Practice basic biosecurity protocols. Overall, CAE is not always fatal and can be managed with proper biosecurity and breeding practices. However, care and consideration should be taken into the importance of culling as a responsible breeding practice. Equally, no animal deserves to suffer, and in some cases truly the most humane thing for the animal is euthanasia. Please always consult a veterinarian about CAE. This is a serious disease and can have a huge effect on your farm operations. Thanks for watching, be safe, and have fun.